Thank you so much for your attendance, and I will leave Dr. Mohammed to do his presentation. I hope you enjoyed it, and I hope to see you soon in other webinars. Thank you so much. Professor Mohammed, we're ready for you.
السلام عليكم، مساء الخير جميعا، يعطيكم العافية. شكرا دكتور، الله يعطيك العافية دكتور باسم. It was a great lecture and thank you for the invitations. It was very informative even for me.
Thank you for accepting.
So inshallah, it will be like continuation of the session. It will be quick and informative in the same time, inshallah. بسم الله والصلاة والسلام على رسول الله. جمعة مباركة على الجميع. Wish you really a good day. Thank you for coming even in your weekend. So today I will do just a continuation of what Dr. Basim did. MashaAllah, tabarakallah. He covers like basically whatever like we're using laser for in general. However, this needs like courses and even like master degrees on how to use lasers and to understand the topic and to understand the complication as well, because nothing comes without complication. It looks fancy, it's amazing. If you hear somebody working with laser, but everybody who works with laser knows that it needs like to be carefully educated and be like on the top notch of what's going on in the laser technology. So I will just cover the laser from the aspect of endodontics. As an endodontist, we know we are specialized, simply we are specialized in saving teeth. So many teeth used to be extracted before, and everybody knows that. But now, alhamdulillah, with the advanced technology, with the education, with simplifying the endodontics, it becomes really a predictable procedures, and you can do it, you can save the teeth. And we know our enemies since many, many years. Many studies done in animals and human beings, and we know that microorganisms, especially bacteria, are the main reason. So we have to get rid of the bacteria. And concept of endodontic did not change. For the past 100 years, I watched some movies from somebody in the US. He's doing root canal exactly like the way we are doing it today since 100 years. 100 years, not years. So what's changed is like the way not the way we do it, it changed the technology, the instrument, the advance in the instrument, that's the only thing changed. So rubber dam application is a must. I see so many people, until now they did not use it. So please use rubber dam properly, cleaning and shaving, mechanical preparation, whatever file you like, but you have to adjunct sodium hypochlorite with it. And you can buy this one. You don't need to buy the one from the companies that is very expensive. You get the cheap one for the market. Make sure without flavors or without like smells, different smells. That will do the job for you. And you have to take it fresh every day. Not fill the syringe and leave it for a week. No, every day you get whatever needed for you, use it, and that's it. So cleaning, shaving, obturation, and filling the root also with the corona restoration. This is the basic. We have to follow this basic. If you are not following this basics, there is no point of using laser or anything else. So that's the concept you have to follow, and you have to stick to it. We know so many advances happen in endodontics. I believe everybody today at least used the loop. And loop without light is almost nothing. If you have a light with the loop, it will increase the visibility a lot. Microscope, I know it's expensive, but it's important. Anybody who's like practicing endodontics a lot, microscope is a must. You have to have it in your clinic. Otherwise, you're going to miss a lot of cases. Also, as you can see, the magnification and illumination, it improves the access cavity. You can see, you can clean, you can find the canals, you can obturate perfectly. CBCT as well, cone beam computed tomography, is a big add to endodontics. So now before we start the cases, we know how many canals in there, we know if there is a lesion or not, it's close to vital structure or not. So CBCT is very basic to have it as endodontics, okay? So many changes also in the type of burrs, ultrasonic, files, rotary files. Whoever worked 10 years before or more than 10 years, he knows how tough is endodontics. And now all the files, even with the cheap prices, it can do a good job. And especially in curved canal like this, you can do it with almost any file now in the market with the cheap ones. So all these advancement and all of these technology you can buy to improve your work, and it's gonna keep improving, but anatomy is something unpredictable. With all the improvement, as I said, The anatomy is one of the tough things that to appreciate. Some people comes with difficult anatomy. And you can see these teeth, they did a clearance for the teeth and they inject ink inside. And you can see what is about the fans is not a canal, it's actually a system. And you can see how those places, no matter what you do, it's difficult to appreciate. And one of the most important studies that we had in endodontics about O.V. Peter is said, and he found about 35% of the root canal system are not touched. So you do the cleaning, you use the best file ever, blah, blah, blah. Then you end up by about 35% of the canal is not touched. And smear layer is created. And that smear layer will fill these parts, okay? It will fill that part. And actually it will make your, all these green parts here, as you can see in the cursor, it will be filled with debris, with bacteria, with so many things. It will block the dentinal tubule. And also the smear layer that's created, it will also plug all these dentinal tubules. So it will be really difficult to remove all of that. So we have irrigation. That's one of the things that we had for a long time ago. Chlorhexidine, EDTA, and sodium hypochlorite. If you only have to use only one solution, sodium hypochlorite is the one to be used and is a must. Those people who are still working with only saline, they are not doing endodontics. I've seen people until now they're doing that, unfortunately. And to deliver that one properly to the root canal system, there is so many improvements. Now we have small needles with a side vented that goes all the way down to make sure that we deliver the solution all the way down, and also in the same time for safety. I don't want a sodium hypochlorite to be spilled outside. The old needle we used to have like this in the left side, it's actually dangerous. If you increase it, I mean, if you push harder, it might go out and do some sodium hypochlorite accident. So also we have activation of the solutions with ultrasonics that can make the solution moves and goes to the fins, to the lateral canals, to the places that cannot be touched with the files, even with ultrasonic. So there's so many ways, so many improvements, so many technology that helps for the cleaning and shaping and disinfection. And we have really a good success rate. As we reach in the root canal treatment, the primary one, it can reach up to 95%, 98% success rate. And even when there is teeth with lesion, with apical radiolucency, it can reach to up to like 85% or 90% of success rate. However, success rate is defined as 100% minus X, meaning any problem in your protocol, any problem in your solution, any problem in, for example, difficult anatomy, that will reduce the success rate. So how can we improve it? We can improve it. And why we have to improve it? To kill the bacteria, as we know. Everybody knows that. Always think about this one. Solution to be used to have to kill the bacteria. Saline does not do that. And this is why we incorporated laser in endodontics. In endodontics, laser can be used in many things, and we can discuss that, inshallah, in this presentation. But the main use of laser in endodontics is disinfection. Disinfection and disinfection, okay? So laser is not something new in dentistry. Actually, it's been used since like 50 years from now. But, you know, with the advance in knowledge, in technology, the devices, there is many type of devices, smaller and bigger with different technology, and every device with a limited or with a specific powers and a specific mood, specific job. So we're gonna go through this now. The main thing in endodontics, the application of laser, it comes by the fiber optic handpiece or tips. So mainly we have these two, either that tip that goes in the pulp chamber only, or the other one can go all the way down. If you do the cleaning and shaping with the normal file we use, then you can deliver the tip of the laser all the way down, and you do your job by disinfection, disrupting the smear layer, and killing the bacteria. So this is the main one, but we have extra, we're gonna go through it today. This is some of the cases that have been treated by laser. If somebody told you, okay, this root canal done by laser, it doesn't mean that from A to Z. Laser is an adjunctive technology. It makes your life easier, guarantee that you reach area that you cannot be reached with the normal files, deliver the solution all the way to the root canal system, and after that, the sealer and gutta percha will follow. So put this in your mind. If somebody told you, okay, this root canal done by laser, it's not laser doing everything. You have to do your job as an endodontist, do the cleaning, do the shaping, and you use laser to improve this one to, as we said, success is 100% minus X. We try to remove the X at all. And you see how's the root canal system here treated. Something you can appreciate with the regular system we're having, but here at least we know and guarantee that more debris is removed and more bacteria being killed. So many applications of in endodontics, as you can see here, like in 2 slides, so many applications. This lecture is just introductory, so I will just go through the most important one that you need to know. Whoever go to the hospital and they put that in your finger and you see the laser Doppler flowmetry, oximetry that measure the blood flow in your body or in your finger or wherever. We do the same thing. We have the same idea. We adapt the device and we can apply it to the teeth, and we can exactly know the flow of the blood in the tooth. This one is very important, especially if you have a trauma in a young age person, not completely developed root. With the electric pulse test and with the cold test, you cannot get a result. So this one is there. It's done a lot in research, but it's not very practical, but something you need to know. That is here, and it's like have 100% almost can give you the result. This tooth has blood, which means vital or not. The other thing which is interesting, as Dr. Basim mentioned, there is some devices or laser for hard tissue including enamel as well. It's very expensive device and it's time consuming as well. You see here the traditional access cavity, here some conservative, all with burrs and ultrasonic, but here the one with laser. You see like how accurate, how small, and that one is amazing. It's perfect. It's minimal invasive, but it takes a lot of time. And this device doing that is very expensive. In vital pulp therapy, meaning direct pulp capping and pulpotomy, the most important thing, whoever had like direct pulp capping procedure or pulpotomy, we're having a problem with the hemostasis. We need to stop the bleeding, better sterilization. We have to also like stop the blood. We need to sterilize the area. We used to use sodium hypochlorite, or some people use formicrosol, which is not, I don't advise to use it. And the good thing in laser here, we guarantee the hemostasis, better sterilization, and we can also stimulate the inflammation to build a dentin bridge. So we do all of that to have a dentin bridge, and laser can do that and more. And we can watch a small video here. You can see like how is the application of this kind of laser. I'm not doing the drilling with the round burr. We are doing the cutting of the tissue, which is partially soft, with the laser itself. And after with the cleaning, applying rubber dam, so you can get like spoon excavator to make sure that the corner is clean and everything is fine. Then you're gonna take care of the pulp. Normally in this case is what we do. I normally like have a sponge or like a cotton with sodium hypochlorite. I apply it there. I try to remove that layer with like small new round burr to make sure we try to stop the bleeding. Then we go forward. But here with the laser, I think this the green thing is like an aiming beam, as Dr. Basim mentioned before. So here we can, you see, go around the tooth, go around the pulp. We try to sterilize and stop the bleeding. And this one can apply either you are doing this direct pulp capping, or even if you have like pulpotomy, you need to remove some of the pulp tissue. This one will guarantee that you remove the pulp tissue and you have hemostasis in the same time. I will see how the area is clean and nice. So somebody may say, you know, why I do use laser? I can just use the burr and that's it. Yes, you can drive a cheap car or you can drive Mercedes. Okay, so laser is something fancy, something advantageous, something that handy. Also, if you have it in your clinic, it will improve your success rate. Then we can apply the same procedure. We can apply the biomaterials we have, like MTA, bioceramic, whatever. Then you continue the same process. The other thing, which is disinfection, as I said before, disinfection and bacteria is the most important thing, and laser helped a lot. We know that bacteria can travel in the dentinal tubule more than 200 microns, and with the smear layer in there, it's very difficult to reach that area. So at some point of time, some leakage happen, then the bacteria go back again and do the disinfection and do the infection again, the root canal system. So laser significantly reduced the bacteria count, and in some studies, it shows to be like killing the bacteria almost 100%. And here it's smear layer, as we know before, smear layer like that, a layer that can happening after cleaning and shaping process, and you can close the dentinal tubule, which include bacteria inside. And they found in research combination of laser with no sodium hypochlorite and EDTA can significantly improve smear layer removal. Remember here, Laser cannot do everything alone. Laser is a very big adjunct in endodontics. So put this in your mind always, okay? I will show you this animation. It's a kind of a lengthy, but it will explain the whole process, how I can apply laser in endodontics. And this procedure can be done with different type of laser. Depends on the laser you have, you will do the procedure. And you will see like now in different video, I will explain more and more. So in this laser, most probably this is an erbium laser with the stronger and more expensive ones. After having small access cavity or the normal access cavity you like, it's up to you. So you apply the tip on the coronal part, and this part will remove the pulp tissues, will remove the debris, will remove any calcification. So after that, once you take this out and you look with the loupe or microscope, you will find the orifices of the root canal. So then you can go forward and do the cleaning and shading. So as I said, depends on your protocol and depends on the light laser tip you have or device also. Either you can do cleaning and shaping the normal way we do it. I use file 35 or 30 or 25, it's up to you. Then you can apply the laser tip all the way down like this. Or the other type of laser, and we can see here also, that laser, you just have a minimum preparation. You can use file maybe 2004, or maybe smaller in some types, and you apply the tip of the laser in the coronal part, and it will do the job as well. So let's see how this goes. It goes there, and with the tip, with the air bubbles, it goes there, vaporize the water, cause some cavitation, pressure wave, and that will it keeps like pushing, and remove all that debris, and to remove the smear layer, and it will expose the dentinal tubule. Then after that, you can follow with another shot of irrigation solution, whatever. Now, so far, we're not using sodium hypochlorite. We're using normal water here. With the help of the laser energy, it will cause all of this, removing all of these debris and exposing the dentinal tubule. After that, you can apply your sodium hypochlorite, EDTA also after this one to remove the smear layer, to help in the removing the smear layer. And you can apply sodium hypochlorite. Sodium hypochlorite, after that, with some activation also with the laser, it will go deeper in the root canal system, deeper in the isthmuses and the dentinal tubule, and kills those bacteria. So this is really important. You see now, also you can remove all my things. Then I will apply the solution. And now you go with the tip all the way down, and you do this movement. See, with drawing, you don't want to push it down there and keep up and down. You might have some extrusion outside. So we go almost all the way down to 1 millimeter or 2. Then we taking it out and doing the activation, taking it out and doing the activation. And this is how it goes. It will activate the sodium hypochlorite to reach the bacteria, to kill the bacteria. The bacteria also can be killed by the energy itself. It can be killed by the heat. Like so many ways to kill the bacteria with. So far, as we reaching after removing smear layer, there is so many ways we removing smear layer, and it can be removed and disinfected at the same time. Also, let's assume that you use the first line and you remove the smear layer. Then you use also different type of laser to activate the solution. It will enhance the irrigation. It will generate a vapor bubbles and acoustic streaming, creating a 3-dimensional fluid movement, as we show before, and I will see you a different one. Here, let's say you have a diode laser, which is something is practical and cheaper than the erbium laser. After you do your regular cleaning and shaping, you put the solution. Then you start having this tip, and you go inside the pulp chamber, and you go inside the root canal. It depends on the tips you have, and you do the activation. It looks like you're from the Star Wars, but it's something, it's really working. Or this is a different tip from a different device. This is from the erbium, as you see here, from erbium black laser. You see the tip, applying the tip to the pulp chamber, not going all the way down to the root canal system, and it can do really a lot of activation and disinfection. Also here, I want to show you how it looks like in the tooth model. So this is the erbium laser that just go to the pulp chamber. Here, he will put some irrigation and applying the laser. And you see how the bubble and how the solution moves inside the root canal system. Let's see now. You can see how the bubbles and how the solution and traveling and more. And he's just putting the device in the same place. It's not moving. Other videos you have seen, they go all the way down and they withdraw. That's, as I said, it depends what kind of laser you have, what kind of tip you have. You need to be aware. We're going to cover that later. We have to understand what device you have and what the job your device can do. So far so good. Now we reach the two most important and expensive one from Photona. This technology called photon-induced photoacoustic streaming, and the other one is sweep. It's all from the same company, same device, but it's different technique. This one is very important because the lasers before, the one we're using before, it increased the heat, and the heat can affect the periodontal ligament and etc. This one, it minimized the heat injury, okay, in the root canal system and periapical tissues. It's very expensive laser, it's very amazing laser, and have very superior efficacy to removing calcium hydroxide, smear layer, than the other old devices we used to use in endodontics. The other one also, they do the same job, but with more improvement. It employs double pulse energy. It's like double pulse, not the single pulse like the first one. It has a generated stronger photoacoustic flow due to more substantial water particle explosions. I will show you a video that using the same device on the tooth, and they're using this two technique in the same time. So these devices from Photona, it's amazing, but it's very expensive. If you want to buy that one, it's you have to think about it twice, and you have to be using it in different applications, not only just to activate the solution in endodontics. We're going to talk about this part at the end of the lecture. I think we are doing so far with the time. So this one, as you can see, it minimized invasive with less instrumentation. This kind of laser, if you have this one, the PIPs and the sweep methods, you can only have very minimal root canal preparation with a small file, up to 2004 or 1504, 1506, or as the tooth allows you. You remember the anatomy I showed you? You remember the picture that we showed before? It has sometimes you have a limitation. You cannot reach all the way down to the root canal system. So this one will help a lot. You see the difference from the right and the left. They're all doing a good job, but you see the sweep mood is quite amazing. You see how fast they can work, and you see the waves and you see the shocks, and that remove the smear layer, the debris, the bacteria at the same time, and also killing the bacteria by the use of sodium hypochlorite, and even from the heat from the device, and also from the energy itself. So, as I said, depends on the kind of device you have. You need to know the mood, how this device kills the bacteria or improve the activation of the solution. Here, this technology, photodynamic therapy, non-thermal disinfection. You see the composite, how the composite works. There is photosynthesizers, okay? Inside, you apply the light and the composite becomes stronger. Here, the same idea. After cleaning and shaving, you place this solution inside, and that solution have a photosynthesizing agent. When you apply the energy, it's very low energy, not compared to the first one we have. And that agent inside, it becomes excited, and it formation of reactive oxygen species. That species will kill the bacteria. You see the process, you see the uses of laser. It depends what kind of laser. You need to have specific information about what the laser you have and what's the uses of that laser. You cannot just take any laser and put it in the root canal system and you think it will do the job for you. No, you have to know what you have exactly and how can you use it safely. So this part is done from the cleaning and shaving and disinfection, which is the most important part of laser and endodontics, as I believe. However, there is many uses as well. Dr. Basim talked about it already, the photobiomodulation to reduce the pain. After finishing the root canal system, you can apply the beam from the buccal side and lingual or palatal side of the tooth, and that will increase or decrease the pain dramatically. And some study shows a lot of promising result. So if you have it in the clinic, why don't you apply to the patient and see how good you can give to the patient, quality of life. Endodontic surgery. Actually, I learned a lot while preparing this lecture. I really admire Dr. Basim, and thank you for the invitation again from Dental Zone and from Dr. Basim, because it gives me opportunity to discover what laser is doing. Because when I'm training in my postgrad program, I did not expose to laser a lot. I just know it's there, but I didn't use it at that time. So now I'm preparing the lecture. I see there is so many advances. Look at this. You see, applying laser in endodontic surgery. At the beginning, when they're cutting through the gum with the laser, I know this is normal. We know that for a long time. It can be saved with less bleeding, with hemostasis in the same time, then normal right reflection. But when it comes to removing the hard tissues, as you will see now, They are using the laser itself. This is erbium laser that Dr. Basil mentioned before, the expensive one. They are using the tip to cut the bone and they cut the root tip. This one is precise, conservative. Yes, it will take time. But as I said before, it's the way how you want to run your clinic, how you want to run your procedure. What do you think? What do you want the patient to know about how you do procedure in your clinic? This is all about you. It's all about precision. It's all about investment. So there's so many things you can do with the laser, from soft tissue to hard tissue. Depends on the investment you want to have. Look at this. After removal, the bone. Now he start to remove the root tip. Just amazing technology. After removing that, now after cutting the root tip, now he will just do the normal job by removing the broken tip and do the retroprep and close the root canal system. So sorry, close the surgical site. Also, this one can do two things in the same time: cutting the many things actually. Cutting the tissues, disinfection in the same time, and also the energy that going there, it will do some disinfection, and also we can do it with less bleeding as well. So laser can be used also as expected for removing of the root canal system. For the treatment, it helps a lot to remove some of the debris and some of the old filling material. Look at this case, removing that instrument materials, and as you can see, they discover so many things in that root canal system, and that done by the help of laser. If anybody want to have more information, this guy from Albert Einstein University in Philadelphia, he is promoting laser a lot. Go to listen to his lecture. Every resident, postgraduate resident, have a laser, and they do all the job. I've been watching them with the laser. They do minimal preparation of the root canal system, and they apply the laser, and I think they have the erbium, they have the most advanced ones, and they do the obturation, and you can see so many important and beautiful results. So I advise everybody who want to know what exactly and what else the laser can do in endodontics, he can follow this guy and he will see a lot. So what's the advantage of laser? So now I cover many procedures that we know in endodontics, and I cover the most important ones, which comes to the part of activation of the solution, disinfection, removing the smear layers, and even in hard tissue and the surgery. So the laser definitely it enhances the precision. There is no doubt about that. Superior in disinfection without like using a lot of chemicals, reduce the post-operative complication, improve the healing and hemostasis, and that by the help of Dr. Bassem mentioned before, the photobiomodulation. And we have like enhance the patient comfort. Depending on the type of laser, type of procedure, sometimes you don't need to have anesthesia for the patient, as Dr. Bassem mentioned before. So as I said, depends on the laser you have, you can provide a high quality service to your patient, and patient will be very comfortable. You know, patient, they don't like the injection. So if you can provide any treatment without injection, patient will be very happy. And this is follow the trend we're having now. Minimally intervention, minimally invasive dentistry. There is no doubt laser helps a lot on that one. Now everybody, like after seeing that lectures, after seeing that videos, they say, wow, this is amazing. If I have laser, then my life will be easier and faster. But you have to put in your mind, there's so many things that you have to take care of it. First, the cost. Are you ready to buy that laser in your like clinic? Are you ready for that? It also needs like a learning curve. You cannot just buy it and go next day and work with it. You have to know exactly like how it works. You have to watch. You have to keep following. You have to be aware about the potential damage to the eye, to the tissues. There is so many things that to be aware about. And the other thing, which is more physical, challenge uniform treatment dentin surface is a curved tooth canal, meaning that the beam, if you apply the beam in the coronal part and there is a curved canal, the laser cannot go around the curve. It's light, it goes just in straight lines. But also it does a great job, as we know, and we have different tips to overcome that one. Also, some of the limitation as well, we are aware about apical extrusion. If you are not aware about what you are doing, you might push the tissues and solution outside the root canal system. Also, the carbonation effect. Some laser, if not using carefully, you might burn the patient or the tissues. And one important thing when it comes like from academia point of view, the studies and the clinical studies on the laser are contradictory, meaning most of the procedure in dentistry now, we have a literature review about it, we have like success rate, we have protocols, we know how to use it, and we follow many institute. The laser is still evolving, and you will see like some different result, different experience, people using it in a different way, because something is still evolving. So it needs like more control study of that. So if somebody decided to have a laser in his clinic, it's not something that you can go in the market and buy it and go next day work with it. First, you have to understand what's laser, how the laser works, how can I benefit from that laser to myself, to the clinic. Then decide the appropriate laser selection, how many people are working in your clinic, what kind of specialties. So you can adopt and buy the laser that is specific to your job. You cannot buy very expensive laser device, then you just use it for activation of the solution or cutting the gum. So you have to be wise about your decision. Definitely you have to adhere to the protocol. As we said, there is no standardization for lasers so far because it's new things coming, there is more advancement, there is different way to use it. So adhere to the protocol is very critical part. And continuous education and skill development, this is a must in laser. You cannot just buy the laser and keep using it without listening to people, attending conference, attending like with some people with more experience to show you how to use it, to avoid any damage to you or to your, your assistant or to the patient itself. So in future direction in endodontic laser, first we have to have, as I said, rigorous clinical trials. It's very important. And also you have to have the long-term efficacy and safety. Now, as I said, root canal treatment's we've been doing root canal for a long time. We have a good success rate. So to compare that to laser, we have to do studies using laser and without using laser, using different kind of laser, and follow it up for 10, 20 years to say, okay, we have to use laser or laser improve a lot. Yes, I know it's improving, but eventually we are guided by literature. We are guided by science. You have to mention exactly what's the reference for you to say this will give me a high success rate. There is so many studies, yes, it's there, but as we said, it's like some contradictory and it needs to be supported more and more. To have a standardized guideline, as I said, and the thing that you have to be very important, efficiency and cost optimization. As I said, now there is so many changes, there is so many development. You need, when you are buying a laser, to see a laser that fit your needs and with and give you the efficiency you need with a reasonable cost, okay? In conclusion, so I try to make this lecture quick so we can listen to any questions. Laser is very important, it's very promising, and is very important adjunct. Remember the word adjunct. You cannot do complete root canal treatment without laser, but laser, if you got the right device, with the right use, it can improve your success. It can improve your clinical output. It can make your patient happier. If you got the good one and follow the instruction and be educated and aware about the benefit and limitation of laser. So careful consideration of the cost and the training and the potential risk is essential for optimal integration. Thanks again to Dr. Bassem for this kind invitation, and thanks to the Dental Zone. And I wish you enjoyed the lecture, and I would welcome any question from you or from Dr. Bassem.